I hit the record button.
What was our question again? Just what we're going to do?
What are we going to do to
Yeah,
continue
next
this work?
steps. How are you going to continue this work beyond the report being published? And so let me turn off my mic and my camera. Where am I?
Can we go around and introduce ourselves?
I was going to
Yeah.
suggest the same thing.
Yeah.
Right,
I'm
so
Kelly Powers. I think you guys know me, and that I'm on Cascade Care. So yeah.
That's your claim to fame?
Yeah.
You're on Cascade. Okay. I'm Aaron Katz. I'm a retired faculty at the University of Washington School of Public Health.
I'm Brenda Snyder. I'm the policy director at the State Treasurer's Office. So I've kind of been the quiet one along the way. I think those have heard me. I think at the last meeting, you heard my comments that, you know, not an expert in healthcare by any means. Kind of more looking at it just from the financial component of it. So cool. I've been actively listening, but didn't want to jump in with healthcare knowledge that I do not have. So I'm here.
Great.
It's important.
I'm Representative Joe Schmeck. I represent the 9th Legislative District. I'm the ranking member on Healthcare and Wellness Committee in the House.
Glad you're here.
Okay, so I'll go next. I'm Chris Bandley. I'm the Executive Director of the Association of Washington Healthcare Plans.
Right.
And I am Mohammed Shidani. I'm the Deputy Director of Somali Health Board. It's a small nonprofit organization.
Good to see you again.
Thank you.
Well, what's everybody gonna do? I did hear Representative Macri say something that we need to do.
Well, maybe I'll just throw some bones on the table. I'm working with a few folks and a few folks in Olympia, trying to think through a bill that would kind of put all these pieces that we've been talking about for 15 months together, from sort of a goal statement around a universal coverage system, and a legislative commitment towards that end, and then on top of that would be this thing we've been calling Model C, but that is, what are the things that we could be doing over the next couple of years that would get more people affordable coverage to care and help build the structures that we would need in order for Model A, for example, to be implemented, say 4 or 5 years down the road. So that's one thing, and the other thing is, I've been talking with some colleagues at the university about how we could be helpful to that effort. We haven't come to any conclusions. We don't have any proposals, but I do think as a public university, we have a role and a responsibility to be supportive of any legislative effort that would move in that direction.
Mm-hmm. Well, I guess I'm going to be tireless in my efforts to make the support for our end goal visible to legislators and to really feel the pressure. That's what I'm going to do.
One thing that this is not what I'm going to be doing, because it's, again, not what our office does. But one thing that I did, I wrote this in the comments when we got the fiscal analysis of the cost of things. And I know that we've been really, strongly about the cost savings in the long run. But I would put it out there again that, the cost burden on the state, the drastic shift from the current system to putting $26 billion on the state, that's going to be a really, really heavy lift. And so I think that that's just a word of caution as it goes forward of, let's not put that on the back burner. Let's not, say, let's figure out all the ways, all the models, all the plans, and then we'll get to finances. Because I think the financial component is really important, and that if that can get answered and addressed sooner rather than later, then you don't have the potential of it dying politically right off the bat. And that's
really
something
disappointed that we didn't get that.
But I think that we need to make sure that we're clear about that, and I made that comment, I think, in a breakout room last time too. But I do have just concerns of really quickly when we say, hey, we're going to have to essentially double the state's general budget to do this. I mean, where's that money going to come from? And, right off the bat,
we're going to have premiums. So in a way, it's like saying, it would be like saying if you were talking to Premier Blue Cross and just saying what they pay out and not factoring in that they have revenue coming in, right?
Right.
So
but
there will be revenue coming in.
Right, but that's a piece that we don't have in this report right now that I think should be one of the first next steps.
Yes.
Is let's address the money, because that's got to be clear. Because people like me, again, who are not the healthcare expert but are looking at it monetarily, that's my main question is, hey, like, by all means, do I want everyone in my neighborhood to have healthcare? Of course I do. I would be an evil human being to say, no, my neighbor Joe can't have it, but my neighbor Sally can. I mean, really, who does that? But if that financial component is not addressed pretty quickly and figured out, I'm afraid that it can stay in the idea space and never in the actuality space.
So would you support having just a work group focusing on the financial component?
I think that's really important that there's at least somewhere along the way that there is a very clear agenda on that. Yeah.
Yeah, that's a really, really important point.
I think that would be great.
Chris, what are your members thinking about? I mean, and this is a very challenging thing for you, I know, and probably for your members, but.
So I guess I would put it this way. I mean, obviously I'm in a little bit of a different position, working for an industry that would be either eliminated under one option or, radically altered under another. So, I think it's probably fair to say that, as an industry, we won't be pursuing those, that pathway either in the legislative process or elsewhere. But that said, when you want to call it Model C or just what we usually talk about in Olympia anyway, I think there's a lot of really good ideas out there for how to improve the current system, how to expand the current system to the populations it's not serving, how to serve the populations it is serving better, and and we're always engaged in and open to those conversations. So I don't know that we'll ever be. Well, I would say it's unlikely we'll ever be in the vanguard where some of you all live, and that's fine. But I think there is still meaningful efforts in places that we will be engaged in. Hopefully, if we don't agree on the end goal of the process, we can work with y'all and others on on things that we can agree on, at least in the meantime.
Yeah, it makes sense.
Mohammed, I've been really curious about what you've thought throughout this process, just from your community and.
Thank you, Kelly. So I think the process in itself, for me, was really a very important learning journey.
Yeah, me too.
How these things go and how, how the decisions come about. But also, it taught me a few important lessons about, the importance of being, involved, being on the table. I know in the beginning, I might have made some comments about some communities, smaller communities out there who do not have a voice in this kind of discussions. But I think that number has significantly increased because of the pandemic now. So while universal health care for the state is really good, I think the focus needs to be more like urgent measures to help people out. But I've learned a lot, and as an organization, we'll keep continue engaging with the conversation and always add our input.
It's funny you mentioned that, Mohammed, because I was just thinking, I wonder if Washington State needs a COVID relief bill of its own with emergency healthcare for people, kind of mirroring the one that is at the federal level, which would require the Senate to pass. I've been thinking about that, address that urgent problem you're talking about.
Yes, and also something also we are a very small organization. We've been officially a nonprofit since 2014, but we've done a little bit of work within the community because we're very much attached to the community and within the community. And something we started noticing in the beginning of the pandemic was people were really, because there was no structure for them, so people were hurting, like health-wise, but more importantly, financially. People weren't sure what to do and where to go, and we also did not have a structure in place to help our community members. So we're still running around, stretching thin whatever little money that we have to pay rents and food and things like that. So
you're,
sure
you're involved in directly supporting members of your community to just keep their homes, get food on the table. Yeah,
and maybe one thing I might want to add is some of the things that was happening all around the county. So we live in King County, which is a big county, but nobody knew how to get to these communities until we started actually actively engaging with University of Washington Public Health, like the big hospitals, to bring tests to these communities. Otherwise, everybody thinks that it's hard to reach these communities, but we provided we engaged with them directly to bring these tests here and there. And we had support. So we're actually doing tests as early as May in Tukwila, Renton, Federal Way.
Oh, wow, that's fantastic. One of your focuses was getting COVID testing.
COVID testing.
Getting the word out about it. And
then when we brought this, large number of communities, other organizations stepped in with resources and, self-care packages and things like that.
Self-care package.
Representative Schmick, I wonder what your thoughts are about this whole process and, coming up to the next legislative session, which will convene in 4 weeks.
Well, I went through this whole process, so I'd have firsthand knowledge to hear and to listen. Are there problems out there? Yeah. Yep. Not going to say there isn't, because there is. I guess at the end of the day, I have to come up with policy that will work. And so I'd say I got my hands full. Frankly, I have enjoyed listening to all the perspectives and whatnot, but I also think there's some real challenges with this. I mean, you're talking about throwing out an existing system for the unknown. And there are a lot of issues along with that go hand in hand with that. I'm sorry. I'm very uncertain that there is this universal desire to want to go there. I mean, looking at the numbers, you're talking about a minuscule amount of savings and frankly, I've been in government long enough, unfortunately, that everything costs more than what you plan. There's always more uptake. And I can give you direct examples. When we were debating about Medicaid expansion, we had an urban report. They came in and we paid them to do it. And they said we would see 328,000 people come in total. Well, frankly, we passed that by $120 some thousand the first year. And now Medicaid expansion is approaching 1 million lives. And we planned for 328,000. And so I am really concerned when you start looking at these numbers, and that such a minuscule amount of savings I really question. And it's just because of experience that I've had. We always underestimate, and who's going to be left to pick up the bag. So there's a lot of things to balance here. I appreciate hearing everyone's perspective, but there's a lot of work to be done if this is ever going to come to fruition, to tease this all out and all the details around it, and frankly, to get the support to trash the system that we currently have for something that's really unknown.
Yeah, I think those are really important questions or important points you make. This is a heavy lift, no matter how you look at it.
There's no magic wand.
No.
I had another question for I'm gonna have to, sorry, for Brenda. I was wondering what the latest thinking is on the state bank, and if that is going to be part of this legislature, or what?
I don't know. I've heard that the proponents of it are working on a bill, but I haven't seen anything drop yet. Okay. So we'll have to see. Yeah.
All right. It seems tangential, but I think it is related. Yeah. Great. Did they give us a lot of time for this? They did. It's only 3:35.
So all of you have been here and you've listened, you've gone through this process. What you've said what you're going to do to continue to work on it, but what have been your takeaways? We spent a year and a half doing this.
Right. Well, I mean, I guess is what I would say is and part of it is, the happenstance of COVID, right? We started out, in the, in an environment, that was sort of this same thing. We wanted to, some of us wanted to reform the state's healthcare system, and we could point to all the problems that that the system had, but there was nothing particularly compelling about that. But COVID has really, to me, really raised the stakes. I don't know about you, but in March, April, May, I go to the store, and one of the things that's on my mind is, who of these folks don't?
Oh, you dropped out, Aaron.
What's that?
You dropped out.
Okay. Who are which of these folks are not insured or can't afford to go see a doctor, even though they have a fever or they have a cough? And that worried me. I mean, I was always concerned about that, but that worried me, because now it's not just a esoteric thing about somebody not being able to get care, but it's actually a threat to me, my family, my friends, my community. So I think COVID really, to me, raised the stakes about this whole process. And, I think that came out certainly in the public testimony, which I think got more, vigorous, as the months went on, calling for this work group to actually, speak with a voice, with a louder voice. Yeah, I guess that, to me, that's a big thing. There's a lot of work, as you said, Representative Schmidt. There would be a lot of work that would have to be done.
Yeah.
Even if we were all to agree, let's commit to model B, let's say, in 5 years. There's a long distance between here and there, not just the financing, as Brenda reminds us, but in the whole infrastructure, the administrative infrastructure, the regulatory infrastructure. I think that's, unfortunately, the work group wasn't given enough time or much less resources to actually do that work.
Right.
So a big question is, who is going to, if we're going to do this, if the legislature agrees that we need to move in that direction, who is going to do that work, under what auspices, with what resources, over what time period? So those are, big questions that remain.
Can I jump onto your thoughts about COVID, Aaron? Because I haven't said this publicly, but we were contemplating having my husband, who's a few years from Medicare, not be insured, just run the risk till he gets a couple years until he gets to Medicare. But then COVID hit, and so now here we'll
Right
see.
now it's
we'll
not,
see how far we can
right.
get.
It's not.
Yeah.
Now at that point, it's not, oh, I might get hit by a bus,
Right.
but, oh, I could catch this virus that I can't see, that's
Right.
clearly everywhere in the community.
That my teenager could bring home.
Right, exactly.
Very easily.
Yeah, raise the
Yeah.
stakes.
Yeah.
The stakes. And then of course we see what's happening in the medical care system. In many places across the state, and of course across the country, where many places are very, getting close to the limit in their ability to staff ICU beds that are being filled with people who have COVID. And if a fair number of those folks are not insured, it means what? The hospital is eating the costs.
Mm-hmm.
And hospitals, especially in rural communities,
Mm-hmm.
they don't have the margins
No.
to eat those costs. So,
local
raise
governments
stakes
are just-
in that way as well.
Yeah. I'm really worried about that. I'm really worried about the long-term impact on healthcare workers and who will stay in their jobs, who will,
Yeah.
it's really intense.
Yeah, here in Anacortes, where I live, we have a roughly 40 bed hospital. And like a lot of, all the hospitals around the state, they had to shut down all non-elective activities. Well, that meant a whole bunch of people were furloughed.
Right.
So that sort of added to the unemployment situation here. And, people who, we call this elective procedures, but a lot of these elective procedures are for things that people really need in order to be able to carry out their daily lives. So, what came to my mind was the sort of absurdity of basing the financial well-being of hospitals and other healthcare providers on sort of daily patient revenue.
Yeah.
Because when that revenue goes away,
yeah,
it jeopardizes the whole capacity of that hospital. And we rely on that hospital. It's our safety net. So, yeah.
Yeah. It's like relying on gasoline for roads. It doesn't.
Yeah. Hmm.
Yeah. Hmm.
Yeah, and that's, that's of course, multiplied, many times throughout the whole economy. I mean, you could say the same thing about, the shops downtown. You can say the same thing about the university,
Mhm. Yeah.
when,
Mm.
so, tuition, when student enrollment is down, tuition is down, and universities and colleges now rely to a vastly greater extent on tuition for their financial well-being than was true 20 years ago.
Right.
And then the state, right, tax revenue is down, and that's where the universities and colleges get other support. And so and since universities, higher education is a discretionary part of the state budget, we're looking at the possibility of those cuts to the university. So you're getting this double whammy. So it's sort of proliferating right through.
It could be we could be in for a brutal.
Right.
Right.
We're relying on Representative Schmick to pull the rabbit out of the hat.
Yeah. Mohammed, any other thoughts about what you're seeing in your community? And oh, can't hear you. You're muted. Sorry, Mohammed.
Yeah, I think if the phrase we're all in the same boat, never, apply it to everyone, this is the time. I think it's everywhere. And one example is when we first started this work group, I wasn't even insured, even though I work full time for a nonprofit. Now,
Right.
it's an organization that does not have money to afford health insurance for employees. But over the process, we were able to, get health insurance for the staff,
That's
and it
amazing.
takes a lot of money, and we don't have that money. It's not available, and everything, the whole system is going to be impacted, and the people who were already experiencing disparities in the health system would even get more problems. And yeah, we wait and pray and see what happens.
And do you guys, are you out in the community, or are you working from home, or how are you?
We're working from home, but I have to be out there all the time to secure masks and little things that the community needs. But yeah, so some of us are actually up front, and a few of our staff had positive COVID tests, but still we can't stop. We have if the only thing the only way to stay healthy mentally is actually make sure that you're doing something about it. Otherwise, you will be frustrated and depressed with the whole circumstances.
Yeah, actually, this has helped me. This work group has helped me to feel I'm trying to do something. So that's been really good. Mm-hmm.
That's what we should put on the front of the report is at least we were trying to do something.
Yeah.
Work group as mental health.
Yeah. Yeah. Well, that's really interesting view into your world. I really appreciate that, Mohammed.
Thank you.
Well, Sean, what's our time frame here?
So 3 more minutes, they will boot us out and just direct
okay.
everyone. So
Okay.
yeah, if folks need to take a quick little break or something, you can certainly do that as well.
Well, I've said my piece.
It did feel like a whirlwind, even though it was a year and a half. It felt since after COVID started, the pace really picked up.
So I'll make a comment. COVID in the city and the COVID in the rural areas are two different things.
I want to hear about that.
I mean, I live in a community where we have a hospital here. I called because I keep track on a pretty regular basis. I mean, I got a hospital that's got nobody in for COVID. I mean, if
You
we
have
didn't have
open beds?
Pullman, excuse me,
You have open beds. You have
open beds. I mean, you've shut down the hospital. I mean, but they're still doing elective surgeries in order to stay alive. They just haven't. We just don't have the COVID cases. If we didn't have Pullman in Whitman County, we'd have. I bet our numbers would be minuscule.
wow.
Because of all the kids that came back.
Right.
That's been the source. But I mean, the numbers just don't. The numbers don't support what's going on with our local economy. I'm sorry. We can operate, we could operate very safely and being open, and yet this one size fits all is really harming our local community. I just threw that in for what it's worth.
No,
But thank you all.
Thank you.